Hello, everyone. On behalf of HR Downloads, I would like to thank you for joining us for today's presentation on Health and Safety 101, COVID-19 edition. We'll cover key considerations that all employers should be thinking about when addressing health and safety concerns in the workplace related to COVID-19. Throughout this webinar, we'll provide you with value-added tips and solutions for identifying, addressing, and helping manage health and safety. My name is Melissa Voigt, and I will be your presenter today. As an HR researcher and writer with HR Downloads, I have extensive experience in developing policies, training, and other resources for our clients. Today's webinar will focus on providing you with tips and suggestions to ensure that your managers are confident and that your employees can keep themselves healthy and safe during the pandemic. We will cover what steps look like opening for Canada, steps for protecting health and safety, and handling questions, objections, and lapses. For our attendees, if you do have any questions throughout today's presentation, just feel free to ask them in the question and answer box to the right of your screen. We'll have a few minutes at the end for a brief Q&A session. And at HR Downloads, we believe that having an actionable plan to implement new concepts is just as important as knowledge itself. So to help you manage health and safety around COVID-19, we're offering a free checklist today to all registrants that addresses the issues that will be discussed in today's webinar. You'll receive the email that you used to register for the webinar within a few business days. So let's get started. So 6 months into Canada's pandemic response, the country has reached the late stages of the various plans. For some, this is called stage 3, others are in stage 4, but that's mostly a difference in just names. Across the country, most businesses are open again and quarantine measures are over, but some restrictions still remain. Gatherings are generally limited, and most populated areas still have mask requirements. This stage of the pandemic response is likely to continue until a vaccine is available, which probably won't be before early 2021 and maybe still later. We just don't know, so we have to presume that this state of affairs will continue for a long time. Some cities have passed additional bylaws, so just don't pay attention to provincial or territorial updates. Be especially attentive to news outbreaks, such as local case numbers, to see if there's a sudden or sustained increase. Governments are likely to reintroduce stricter controls in this area. And make sure your organization is ready for the possibility of another round of quarantine. Being in stage 3 or whatever specific stage that your location is in doesn't mean the danger is over, only that it's currently well managed, and that could change at any time. So basic safety measures. The basic safety measures are the same as the early part of the pandemic, but they're more important now as people go outside and interact with more people than they did in the spring. So physical distancing still matters. Be sure to keep 2 meters apart at all times, which is about 6 feet. And if physical distancing isn't possible, wear a face mask. This is in addition to wearing a mask whenever it's required. Obviously, wash your hands more frequently and be sure to disinfect high contact surfaces. Think door handles, light switches, faucets, shared appliances like coffee makers, microwaves, elevator door buttons. If we want to keep businesses open and safe, we all need to be more careful. So physical distancing. Physical distancing is easiest when everybody stays home. So if your employees can keep working from home, this is something that you should consider letting them do. But it won't be possible for everyone, of course. So there's still going to be options to help people keep 2 meters apart. Some employers are staggering start and end times of their scheduling, as well as breaks and meals, so that employees aren't all trying to use entries or kitchens at the same time. And if you have in public spaces like, let's say, stores, lobbies, and so on, marking out distances on the walls or floors so people know how far apart to stand can help. This includes outdoors if you expect people to wait in line or queues because of occupancy restrictions. And then you can also consider repurposing meeting rooms, empty offices, or other areas as workspaces just to help employees spread out. So alternatives to physical distancing. If physical distancing is just impossible or unworkable, you still have options. Many retailers and service providers have installed barriers to separate workers from the public, and these can work in other workplaces too, just to provide some separation. You can also require masks at all times. And in addition to existing mask requirements, another technique is to create bubbles within your workforce. If people normally work different shifts with many other colleagues, divide things up for now so you have 2 or more of the same groups who are only working with each other. Just remember, reducing the number of people that everyone interacts with can also help reduce the chance of a widespread outbreak, and it makes contact tracing a little bit easier too. Face masks. So there's generally many kinds of masks, but not everyone needs the same level of protection. N95 masks, for example, are generally only necessary or recommended for people that are in highest risks, especially those that are healthcare workers. For most people, disposable medical masks or even reusable cloth masks are good enough. As an employer, you should provide face masks if employees must wear them in the workplace. And make sure that you're providing enough so people can change them as they need, just so they're not using them unsafely. So you could set up like a few per shift per employee and keep enough supply available for workers or even third parties such as clients or the public who are entering your workplace that might forget their mask. And just remember that cities might have specific requirements for masks in public places, so just make sure that you're following all applicable bylaws. Face shields. So face shields are something else to consider, but they don't replace face masks, and most people really have no need to wear them. Shields may provide additional protection from airborne particles when used with properly fitted and worn masks, but permanent barriers are generally better protection than shields because they tend to be larger and intercept particles farther from the worker. So think about the plexiglass partitions that you're seeing at the grocery stores. Hand washing. So hand washing is still an important health and safety measure, so don't let up. Use soap and hot water for 20 seconds and make sure to follow the correct techniques so you don't miss any part of the hand. Most public health units have posters available that you can hang up in bathrooms, kitchens, or anywhere else employees should be washing their hands. Just make sure employees know that when they should wash their hands. This includes before putting their mask on, after removing their mask, after touching any tools or surfaces that might be high contact or others are using, and before handling food, among other circumstances. Hand sanitizer. So hand sanitizers become huge, but it's something that can't replace hand washing, but it's definitely a good temporary substitute when hand washing is impractical. Employees should still wash their hands after every 5 applications of hand sanitizer. But it's important to note that not all hand sanitizers are effective, but any that you should use should have at least a 70% alcohol concentration. Just make sure to follow Health Canada's guidelines and consult the federal government list of any recalled hand sanitizers for more information. So, handling customer objections. So we've probably all seen or heard about customers objecting to mask requirements and other measures. Thankfully, this is only a small percentage of customers, but employers still need to make a plan for handling them. So first, you want to make sure to develop clear policies and apply them consistently. It's important not to make things up as you go along or even leave your employees uncertain about what to do or how to handle a situation. And it's important to also remember that some exemptions do exist and your policies should respect them. But even if a customer can't wear a mask, you still need to take precautions to keep them and everyone else safe. So in addition to some of the methods mentioned earlier, many businesses are still offering things like contactless service, like curbside pickup or deliveries, just to help out customers who can't follow the in-store policies or maybe are unable to wear a mask in your workplace. Accommodation and accessibility. So when customers claim an exemption from mask requirements, follow local guidelines, but in general, businesses cannot demand proof. So note that if you operate in a jurisdiction with accessibility legislation, specifically Manitoba and Ontario, those requirements still apply too. In general, don't make assumptions about whether someone can wear a mask or not. If someone arrives without one, just ask if they need one. And then if they do claim an exemption, just explain what other measures that they can take. Protecting health and safety should be everybody's priority, but each individual might need different or specific accommodations. Supporting employees. Employees will be the first point of contact for most customers and third parties, so make sure that you know your policies and how to handle exemptions. Be consistent with your instructions to them, and if you do have any changes to policies, you need to let them know why. So a lot of employees can receive contradictory direction, and in that case, they're more likely to make mistakes or ignore policies. So this is important just to check with the employees about the effectiveness of your safety measures, such as asking them whether they think the policies are working and what their concerns are. You also want to make sure that you're providing adequate supplies of everything that you do need to keep them safe. So this includes masks, gloves, cleaning supplies, and so on, just depending on the type of work that they do. All right, so now we're going to talk about handling employee objections. You might encounter situations where some employees just fail to follow health and safety procedures, such as not observing proper distancing guidelines in the workplace. You might even face pushback from employees about requests to wear protective equipment such as masks, which in some cities are now mandated in enclosed or public spaces. So for employees who object, refuse, or let's say even ignore health and safety measures, whether it's accidental or deliberately, they should be made aware and know why and how these measures are going to protect them and those that work with them. So as an employer, not only are you required to create a safe work environment for your employees by reducing the risks and health and safety hazards, but you also need to ensure that your employees are aware of public health and safety guidelines or any legislation requirements, such as wearing masks in the workplace where required. But just knowing and not being made aware is not enough. That said, employees are also responsible for following health and safety requirements. You need to have a system in place just to ensure that employees understand that they're responsible and what role that they play in mitigating the transmission and spread of COVID-19 in the workplace, as well as holding them accountable for their actions. So things like acceptable and unacceptable safety expectations and behaviors need to be addressed and communicated. This can be done in health and safety related policies and then reinforced during training or just providing regular communication about current health and safety measures, including any updates or changes. By having a system of accountability in place, workers can then be held responsible and are liable for their actions and behaviors while on the job. So even with all the proper health and safety protocols in place, some employees might still be concerned about their health. Even though they might follow the rules, they could think that the current measures in place are not strict enough or not working. In these situations, just be sure to address the employee and ensure that you've done your due diligence in creating a safe workplace. This can be done by letting them know what measures the organization has taken to protect them. And then you can also consider asking them for additional suggestions or recommendations on what you can do to make them feel safer in the workplace. All right, so work refusals. This has been a big topic coming up, especially over the last couple months. While we all hope employees feel safe when coming to work, not everyone will, and some might even refuse to come to work. So under health and safety legislation, employees do have the right to refuse unsafe or dangerous work if they legitimately feel their safety is at risk, but such refusals must be valid. So if an employee brings up concerns for their safety in the workplace or their right to refuse unsafe work, you do have to take them seriously. It's important not to dismiss their concerns, even if you believe there is no reason for them to worry about their health and safety. But first, find out the exact reasons for the refusal. Be sure your organization is following best practice advice from local public health units just to ensure that you do have all the proper safety measures in place. And then prior to responding to any employee work refusal request, specifically due to unsafe work, it's important that all work refusal protocol has been followed. So this includes investigation and relevant ruling under the appropriate health and safety director. and the minister, and then the workplace has been deemed safe. So certain circumstances where employees do voice their concerns about safety in the workplace, you might also want to consider just making exceptions and offering alternative arrangements or accommodations for them. Now, if an employee does express their right to refuse work that they believe is unsafe due to concerns of COVID-19, this must be treated as a work refusal under normal circumstances. So just how you would handle any other health and safety work-related refusal, the usual processes will apply for evaluating work refusals. So just be sure to consult with your existing policies and procedures that are outlined in the jurisdiction's occupational health and safety legislation, and then respond to those employee concerns appropriately. And before responding to an unsafe work refusal request, it's critical that all work refusal protocol has been followed. So this includes, as we mentioned, an investigation, making sure that it's under the relevant ruling. And then if the employee does believe that they do have a valid reason, just make sure that you're setting expectations for response timelines. With the current climate of the pandemic, things aren't really operating as business as usual, and ministries are likely to have a long backlog of complaints to go through. All right, and next we're going to talk about progressive discipline. Under no circumstances should an employee face any disciplinary action or reprisal for expressing their concern about safety in the workplace, or even bringing up work refusals if they have a reasonable belief that the workplace is unsafe or their job could endanger themselves or others. However, there might be other situations where implementing disciplinary related measures related to health and safety issues is necessary. So this could be for employees that are failing to follow health and safety practices. In these cases, using progressive discipline should only be used as a last resort. So most employee health and safety related mistakes that happen are accidental and unintentional rather than done deliberately. So it's important not to automatically presume that they're purposely ignoring the rules. It can be easy to forget about distancing measures, especially if you're used to being around the same group of people in the workplace regularly, or even for those coworkers that are coming back to work and just haven't had much interaction with anyone in the last few months. They might be excited to see and socialize with others, so they could get a little bit closer, forget distancing measures. But as we're moving through the next phases of the pandemic and restrictions become a little bit more laxed, you'll have to understand so will the actions of others, but it's still going to be important to ensure that everyone is diligent about following the safety guidelines and that you do need to take their actions or lack thereof actions into consideration. So making employees aware of the rules just isn't enough. Safety procedures not only need to be practiced, but they also need to be enforced so employees understand that improper, unsafe behaviors not only are affecting them, but they can put others at risk as well. So because of this, progressive discipline should only be used, as we mentioned, as last resort, but it should be used if an employee is continuously or deliberately violating company health and safety guidelines. And one thing to make sure that you're aware of is disciplinary measures should be used to help employees work on correcting behaviors or lapses in behaviors instead of a form of punishment. So are there currently disciplinary procedures in place for health and safety violations? Are workers aware of what's going to happen if they do violate health and safety rules or practice unsafe work procedures? So make sure as these things are happening, if there are any violations, make sure you're documenting all health and safety related incidents, any discussions, things like counseling sessions and violations. This includes written and verbal warnings. And make sure that you're setting expectations just by establishing clear policies that explain the requirements, disciplinary guidelines, or any other repercussions that employees might face for not following safety protocols. The goal of enforcing safety rules is to keep employees' health and safe first, but using disciplinary measures isn't meant to punish the employee. It's rather to discourage and prevent behaviors that are at risk to health and safety of everyone in the workplace. All right, so for the long-term outlook, as we mentioned earlier, restrictions might be phasing out, but we aren't completely in the clear just yet. Right now, it's entirely uncertain what the future holds. Temporary rules and health and safety measures that were introduced earlier in the year have continued to evolve since public emergency orders were first introduced. And it's likely that as stage outbreaks occur, provinces and cities are likely to continue moving back and forth between those stages. So while we're all eager to move forward into whatever the next phase or steps might be, we should all remember that we all play a role in reducing the spread of COVID-19. By following health and safety best practices in and out of the workplace, it can help keep these outbreaks rare and small. It's not likely that things are going to get back to normal to our pre-pandemic activities or what we were doing in the beginning of the year anytime soon. This is now the new normal, which means it's critical to make sure that employees understand that these health and safety measures need to become habits that are part of our regular routine and how we do our jobs. So the main goal is to keep your employees, customers, and the public safe. So we just need to remember temporarily putting up with discomfort and disruption for now. This will help us in the future just prevent the spread of COVID-19 throughout your organization while ultimately reducing the number of cases. All right. As we near today's webinar, we just want to review some of the main takeaways. So number one, the increased activity of later stages just means a greater danger of infection if people become more careless or more lax with their health and safety protocols. Two, the same practices that we've all gotten used to still work, but some might become lazy or less diligent about them. And three, employers have the greatest responsibility for health and safety in the workplace, so it's now time to be more vigilant than usual. All right, so the topics that are covered in today's webinar can be supported with HR download services. So some of the recommendations for services based on today's presentation include our HR fundamentals. So HR Downloads has Canada's leading library of HR policies, forms, letters, and job descriptions with thousands of customizable documents. We're sure to have what you need. A preventing COVID-19 in the workplace policy, a resuming operations checklist, as well as a personal protective equipment in the office policy that's specific for COVID-19, or even a masks in the workplace policy. And to support you with the items that have been covered in today's webinar, HR Fundamentals also includes access to our in-depth Compliance Center tool, a monthly newsletter guide to the world of Canadian HR news and legislation, as well as unlimited support from our client success team. Live HR advice. So while keeping up with employees' health and safety in the workplace, this can be a rewarding part of the work, but how the intricacies can be challenging. We have a dedicated team of senior HR advisors available to help guide you through any stage of the employment life cycle. Our live HR advice service offers unlimited phone support in English or French, and it's tailored to your unique work environment. So if you're ever in doubt, give us a call. And then we have HR Complete. So discover our complete solutions for your organization through our HR Complete membership. Using HR Complete, you'll have endless resources available to you that include live HR advice, online training, all of our policies, documents, surveys, and more. So our team and our technology can all work together to help find customized solutions that suit your organization's specific needs. We're here to help. All right, so we're just going to take a few minutes now to answer some questions about health and safety related to COVID-19. So just give me 1 second. I'm going to pull this up here. All right, so we did have a couple of questions come in. One of the questions, the first one, says, we do not deal with the public and only have a small number of employees working in the same space. Are masks still required to be worn while in the workplace? So in this case, many places, the use of non-medical masks or face coverings are required in all indoor public spaces. You should always be checking with your local government for bylaws and mandates regarding mask requirements where you live and work. So the mandates in place, they do vary by city to city, and they'll explain specific situations where a face covering is and is not required, as well as go over any exemptions. So certain people that maybe don't have to wear a face covering under the bylaw. If you do work in a location, let's say an office building or anywhere that has a shared space or commons area, You'll also want to make sure that you're checking with the property management or landlord just to find out if they have implemented additional policies that require face coverings. So some might have requirements to wear masks in the lobby or common spaces, such as elevators, hallways, waiting rooms, or any stairwells. And then you should have your own policies in place that cover specific bylaws for your work location. So this includes the protocols for wearing masks, including where they must be worn, who is exempt, and then safe use, such as step-by-step directions for putting them on and taking them off. All right, so we'll take a look at the next question. This one came in and it says, what if physical distancing is impossible in our work environment? Certain jobs and equipment require employees to work closely or directly next to one another, and we have no way for those tasks to get done 6 feet apart. Okay, this is a really good point, and I just wanted to say thanks for bringing that up. We did address this a little bit earlier in the webinar under the physical distancing discussion, but it is understandable that in certain workplaces and certain job duties, physical distancing may be impossible. So we'll dive in a little bit more on this topic. Let's say jobs where employees work in production lines, plants, even restaurants, like having to serve someone their food or drinks. It's not always possible to do their duties 6 feet away from one another. So in these situations, there are many options that can help reduce exposure and keep employees safe. The first is to ensure that employees that are working in close quarters with one another are protected. So the first thing that you can do is make sure that personal protective equipment, such as masks or face shields, are used appropriately and properly for the environment that the employees will be working in. And I know we mentioned a little bit earlier, we briefed on this, if possible, just considering having employees work staggered shifts. This can kind of reduce the amount of people that others are in contact or how many people are in the same space at one time. And then having employees work together in the same bubbles. So scheduling the same employees together consistently and then making sure that they're only in contact with those that are in their work bubble. And if, let's say, working space is an issue, but employees don't need to be interacting with one another, maybe like if they are working on the same piece of equipment. Another option is maybe to build partitions between workspaces. So similar to the barriers that we've seen at grocery stores, plexiglass partitions could be used to separate individual workspaces. So let's say you have employees working on a production line and they only need to be doing things that are in that specific workspace. You could put up maybe walls between each person's space so they're only working within that, certain distance from each other. And then you can also consider including just, temporary, as we mentioned a few times, alternative work arrangements for those that are considered high risk, and making sure that they're not in direct contact with or close quarters with anybody else. So that's another thing, is to find out with those employees if there's a reason that maybe they can't be around anybody else, if they have issues themselves, if they're taking care of somebody that might be at high risk. You definitely don't want to increase their exposure. So if there's a possibility to offer them some sort of alternative work or schedule, definitely take that into consideration. All right, and one other question that came through, and this is, I'm sure, a question that a lot of people have, but what happens if one of my employees tests positive for COVID-19? Do I have to close down? And what do I do about all my other employees? So in this situation, if an employee in your workplace does test positive for COVID-19, they should not return to the office until their self-isolation period of at least 14 days is over. And then making sure that they no longer show symptoms and that they've been cleared to return to work. So if any employees are starting to show symptoms, they should be separated immediately from other employees and then sent home until they've been tested with negative results or until they no longer show symptoms as well. And in the case that somebody does test positive within your workplace, you'll also need to make sure that you're notifying the public health unit immediately for any cases that do happen, as well as making sure that employees or any clients are aware that there has been a positive case in the workplace. Now, it's important not to disclose who or provide any personal information, but they do need to be made aware. So it's extremely important that you're transparent on any cases that have been recognized in the workplace. And then another thing that you can do is just make sure that you're encouraging all employees who have worked with that individual or worked, on the same shift with somebody that's tested positive to make sure that they're getting tested as well. And then anybody that just begins to show or even feel symptoms, send them home. If they can, have them stay home for the self-isolation period or until they get tested, and then they're clear to return to work as well. All right, so we have reached the end of time, so we're just going to conclude today's presentation. As we mentioned earlier, you will receive that checklist and the replay of this webinar within the next week or so through the email that you used to register. And on a final note, I just wanted to thank you all for joining us today. We hope to see you back for our next webinar, so just make sure that you're staying tuned to HR Downloads on social media for the next webinar announcement. Subscribe to our blog. We also frequently post items that are related to our webinars there and include even more content that you can trust. All right, thanks so much and have a great day.